Thank you again to our Senate President Pro Tem, Senator Mike McGuire. And we have a new hashtag, heck to the yes. I love that. I love that. That's our rallying cry today. It is now, I'm delighted to invite to the stage one of our stalwart philanthropic partners, Dr. Sarita Mohanty, the president and CEO of the SCAN Foundation, who has not only shaped California's master plan for aging, but has also been influential across the nation in building multi-sector plans for aging through your generous foundation support. Sarita, please come to the stage.
Well, thank you. Good morning, Susan. Thank you for that introduction. I am so thrilled to be here serving as the president and CEO of the SCAN Foundation, and I am so proud of our mission, which is about reducing health inequities and ensuring that all older adults can age with dignity, respect, and the comprehensive support they need to live full and healthy lives in their home and community. At our foundation, this means strengthening California's aging and health infrastructure and supporting the development of California's Master Plan for Aging, or MPA, to really drive real, lasting change. It's just remarkable to me to reflect on the progress since Governor Newsom announced this executive order calling for an MPA back in June of 2019. You know, at that time, we knew philanthropy. We actually knew philanthropy needed to play a critical role. The MPA was praised at that time for its holistic approach, involving all segments of society in planning for this historic aging of California's diverse population. We recognized at that time that this was our chance to create a thoughtful, comprehensive plan ensuring that equity was embedded throughout. Now, I have to say the SCAN Foundation was especially proud to convene key philanthropic partners, including the Archstone Foundation, West Health, Meta Fund, May and Stanley Charitable Trust, and the Rosalind and Arthur Gilbert Foundation, to collaborate with state leadership in support of the MPA's early development. Through this MPA fund, our philanthropic partners have committed over $4 million to provide real-time, rapid support to the state's master plan efforts. This funding has actually enabled policy research. It has informed data analysis and communication support. The fund has been instrumental in refining the MPA data dashboard and developing outreach toolkits and informing policy development for effective implementation. You know, and since the start of this journey, the momentum, it's amazing, has only grown, drawing attention from other states and federal partners to the critical importance of planning for our aging population. In fact, it's important to highlight the recently released strategic framework for a national plan on aging that highlights this critical need across programs, agencies, and sectors. And today, we are so excited to stand alongside all of you as we announce our shared commitment to supporting the launch of California's first Aging and Disability Lived Experience Advisory Board. So let's give a round of applause for that. Very exciting. And this board will really ensure that all voices of individuals and their communities remain central to the MPA's implementation. Later today, I am also really thrilled that we will hear stories and insights directly from individuals with lived experience, an older adult, a caregiver, a person with a disability. As part of our foundation's collaborative work in partnership with the California Healthcare Foundation and the Meta Fund, we are now working to shift the power to the community through equity community organizing groups, or eco groups. That being said, we've heard that much work remains. And I have the privilege of also being a member of the Impact Stakeholder Committee that advises the California Health and Human Services Agency on the Master Plan for Aging. And we have identified 3 key priorities. One is securing sustainable funding for long-term service and supports, or LTSS. Second is reforming the Medi-Cal share of cost program and the LTSS waivers for better access to care. And third, as we've heard, but just reinforcing this, addressing older adult homelessness with targeted rental subsidies. I would be remiss if I didn't mention that earlier today, Vice President Harris announced a commitment to a Medicare home care benefit that ensures that all Medicare beneficiaries, especially middle-income older adults, what we deem the forgotten middle, can thrive in the place they call home. So very excited about that, yes. You know, these actions are absolutely vital for a more inclusive, supportive system. And as all of these policies continue to be developed, it is important that we hear from the people with lived experiences, as we will today. And I am really confident that the leadership driving the MPA, Susan and your team, through the coordinated all-government approach rooted in equity and centered on what matters most to individuals, will propel us forward and towards success for 2030 and beyond. So I am now really thrilled. It is my distinct pleasure to introduce Secretary Javier Becerra, who serves as the President Biden's cabinet as the 25th Secretary of the U.S. Department of Health and Human Services, and the first Latino to hold office in the history of the United States. Born here in Sacramento, Secretary Becerra is the son of working-class parents. He was the first in his family to receive a 4-year degree, earning his Bachelor's of Arts in Economics at Stanford University. He earned his Juris Doctorate from Stanford Law School. His mother was born in Jalisco, Mexico, and immigrated to the United States after marrying his father, a day laborer turned into construction worker. He is married to Dr. Carolina Reyes, and he is very proud of his 3 daughters, Clarissa, Olivia, and Natalia, and his son-in-law, Ivan. Throughout his career, Secretary Becerra has made it his priority to ensure that Americans have access to the affordable health care they need to survive and thrive. From his early days as a legal advocate representing individuals with behavioral health needs, to his role as Attorney General of the state of California. Secretary Becerra served 12 terms in Congress as a member of California's delegation in the U.S. House of Representatives. Throughout his tenure at the federal and at the state level, he has been a true champion to protect and uplift older adults. And as a member of the Ways and Means Committee, Secretary Becerra introduced legislation, the Medicare Savings Program Improvement Act of 2007, that expanded cost-sharing subsidies for low-income seniors who receive both Medicare and Medicaid benefits. He championed provisions of the Medicare Improvements for Patients and Providers Act of 2008 that required physicians who perform imaging to be accredited and trained to ensure patients' safety. And he was one of the original co-sponsors of the Patient Protection and Affordable Care Act, or ACA, which strengthened Medicare and lowered costs for older adults. As Attorney General of our great state of California, Secretary Becerra took action early in the pandemic to keep Californians safe by using his authority to protect workers from exposure to COVID-19, secure key safeguards for frontline healthcare workers' rights, and take on fraudsters trying to take advantage of people during the pandemic. In addition, he cracked down on Medicare and Medicaid fraud, acted to combat the opioid crisis, and he led the 3-year federal court fight to save the ACA, and with it, the protections of 133 million Americans with pre-existing conditions. So with that, Secretary Becerra, I just want to extend our welcome and thank you so much for joining us today at the Day of Action. We are truly honored to have you here with us today. Thank you.
Good morning. That's a little awkward to jump on stage and all of a sudden do a photograph when you all are just staring. So it's sorry about that. Can I just say it is good to be in California. Dr. Moharty, thank you very much for the introduction. Can I just say one thing? Because good thing, as I'm getting older, it's a good thing when people remind me in the introductions what I did, because that way I don't have to remember it all. But the one thing I believe that I will remember most about the Affordable Care Act work is not helping draft and then pass it, because that was big back in 2010. And I thought the biggest thing I was ever going to get to say is I took the defense of the Affordable Care Act all the way to the Supreme Court, and in that Supreme Court, we won. That was big. But let me tell you what I really appreciate today is that as Secretary of the Department of Health and Human Services, the President has given us an opportunity to take the ACA where it's never gone before. When we came into office in 2021, we'd actually seen a drop in the number of people who had their health insurance coverage through the marketplace in the ACA. It had dipped under 12 million. Today, we're approaching 22 million who are getting their health care through the Affordable Care Act marketplace. And on top of that, there are another about 25 million people who have health care through the Medicaid expansion program that has made it possible for those low-income individuals to access health care. 46 million people today count on their health insurance coverage through the Affordable Care Act. And that's a big deal, as then Vice President Joe Biden said. And it is truly something that we can speak to because it is what this administration has done. So I am thrilled to get to talk to you about something that often is neglected, and that is the aging process. And I think it's unfortunate because we talk so much about making sure we're there where people need us, especially people who have paid their dues up front in life by working really hard all their life. They get the Medicare program, Social Security, but we forget that you can be healthy, and my mom is about to turn 91, and she's still pretty independent. She lives with me and my family, but she's still pretty independent. But we still want someone there just in case. And what we forget is that just because you might look vigorous, you still may need some support. And it doesn't mean you have to go to the hospital. And we are failing some of our hardest working Americans who gave us so much of their life by not saying to them, we don't wait until you're so ill you have to go to the hospital. See, we have a system in America that's geared to treat illness rather than having a healthcare system that's geared to promote wellness. And that's something at HHS we're trying to change. And I learned this, not as secretary, I learned this way before. I learned this when I was a kid. And I always tell folks, I heard it from one of the great Americans of this country. You may not know her that well. Her name is Maria Teresa Becerra. That's my mom. And she said it in one succinct sentence. Me dijo, siempre es mejor prevenir que remediar. My son, it is always better to prevent than to remediate. You may have heard another great American say this, but he said it around 160 years ago. It is easier to build strong children than to repair broken men. Frederick Douglass said that back in the 1800s, and he was talking about how we wait. And in those days, of course, when we still had things like slavery, even worse, but we wait to see adults, men and women, become broken. Then what we do is we have a system of healthcare that tries to treat them once they're broken, rather than investing at all stages of life to promote wellness and build strong children and build strong adults. We wait till they're broken, and then we try to fix it, which is the most expensive way to do healthcare. And so we believe at HHS now that we must move towards promoting wellness. That's why we are very high on food is medicine. If your kids are going to be told they're deficient in their vitamin D, they shouldn't be popping pills. They should be able to do the things that give them naturally the vitamin D, outside play, or whatever it might be. But certainly if it's about nutrition, then fruits and vegetables, nuts and berries, before you pop pills to try to make up for your deficiencies. Food is medicine is a simple thing that most people recognize and can get behind. So we're trying to do a number of things. But let me focus for a second on aging. And here I want to make sure that I thank all the teams that had the foresight to talk about aging into the future and what we're going to do. And to Director Demerois, I want to say to you and your team at the Department of Aging, thank you for spearheading the effort to try to move us in a direction where we're thinking early, preventing, rather than trying to cure and remediate at the end stage for adults who've given so much of their life to building this country. And I have to say, and I'm very proud to say, as the Secretary of the Federal Department of Health and Human Services, that California is at the forefront of pushing this about aging and making sure we have a plan of action, a roadmap for all Californians so we move forward well all the way through the last stages of our life. And congratulations to this state, all of you, for being there to make that happen. So, yes. So, and I know you're going to hear some telling stories, compelling stories, some about basics that you and I just take for granted that we're all always going to be able to have access to the answers that we need. And when you can't get through a phone call to an agency that's supposed to be there to answer your questions, you know how frustrating that can be, especially if you don't have transportation, especially if you're not real versed on computers, you know, in your 70s or 80s or 90s. It's simple things. And these life stories are what should inform us about how we plan that roadmap and what it should look like. But I want to spend a couple of moments to tell you how we're going to join with you in this effort. Because again, as I said, California is taking the lead. California is requesting waivers within our CMS Medicaid authorities to be able to use our Medicaid dollars in far different ways. We are stretching the definition of a Medicaid dollar now. So it's not just reimbursing a doctor visit or a hospital stay, but it's actually now helping cover housing, transportation. Because so long as we leave an individual who is on Medicaid healthier the day after you've done that, isn't that what Medicaid is about? Keeping people healthy? It's not just when you walk into the doctor's office or have to stay in a hospital. That's the old way of treating illness. Promoting wellness is making sure you can make it to your doctor's office and not miss the appointment. Promoting wellness is making sure that you have secure housing so that you don't go weeks, months without a safe place to live, where you don't even know if you have clean water to down the pills that you need to stay healthy. And so we're just being smarter with our Medicaid dollars to work with states that want to be forward-leaning as the state of California. Kinship care. I don't know about you, but I am gratified that my father passed in my house. And he had, for 4 years, the care of his sons and daughters in my house. And his last 6 months of life during hospice care, he was in my house. And we had help, but it was mostly family. And on that New Year's Day in 2020, when he passed, we were all there. We had a chance to say goodbye. And I will tell you, if someone's going to go, that's the way you go. But for too many families, that's not possible. They cannot afford to take time off work. They cannot afford to provide the care. They are too infirm or elderly themselves to offer that support. And rather than be there to help those people who want to try to do that, we make it an impediment. We make it tough for you to want to forego some of your work hours so you can actually spend time with your ill or infirm or elderly loved one. We're changing that. We now want to support kinship care. We want to make it so families can afford to stay home more often if that's what they're willing to do, because it's going to save them a lot of heartache and it's going to save us a lot of money. And I hope California will take this to the limit. Have accountability to make sure no one's gaming the system, but take it to the limit, because the best care you're going to get, because I know some of you probably had this experience where your loved one says, do not take me to a hospital. I will not go to a hospital. I'd rather die right now, but do not take me to a hospital. I do not want to die in a hospital. Take this one to the limit. This administration will be with you, because kinship care is loving care. Loving care is promoting wellness, and promoting wellness is good for America. And so we want to be there with you on kinship care. And we're showing that because we have now passed rules. And you heard this. Medicare is now going to try to get into this business of trying to provide that kind of care opportunity at home. We're trying to advance making sure that you can afford to have someone come to your home and help you. Today, we have a rule in place that requires these agencies that send you someone to your home to help with home care, where soon, that when the rule kicks in, 80% of that Medicaid dollar, your dollar, because it's a taxpayer dollar, that you contribute has to go to pay the workers who are doing the care. So we won't find people that are lifting up your elderly parent, who are changing your loved one who can't do that, and they're making minimum wage, and then running off to another job as soon as they can find that fast food joint where they can flip burgers and make more money. And so we're going to be with you on that, because we think that's the way to go. The final thing I want to tell you is this. I could tell you the stories. I've done some of that care with my sisters and my family. You have some of those stories. We need to hear the stories, because if we don't hear the stories, we won't get the policy as quickly as we should. It is those compelling stories that move Americans. No American wants to see someone suffer at home alone. No American wants to be that one person who is suffering at home alone. We will have Americans, voters with us on this issue. We just have to explain to them how this works. The closer we get to home, the closer we get to love, and the closer we get to care. We are all about making sure we build strong children, strong adults from the beginning. We will repair our broken men and women. We always do. But let's be a little bit smarter, and let's build them strong from the beginning, so we're spending less money to try to get them back to where they should be. And if we do that, then I guarantee you, in a couple of weeks, when that great American, Maria Teresa Becerra, celebrates her birthday and turns 91, she will be happy to know that America is getting closer to finally heeding her wonderful advice, que podemos prevenir en vez de remediar. I look forward to working with you. Do not stop being California. We count on you being California. A little crazy sometimes, but nonetheless, California, we love you. Keep going. And we're never going to bring the U.S. Capitol from Washington, D.C. down to Sacramento, but we don't need to. We're already the 5th largest economy in the world. We're showing the way. Where you go, California will go. And where California goes, so goes the nation. Thank you very much.
I don't know why you think that you could help me when you couldn't get by yourself. And I don't
Thank
know
you.